Welcome to Remote First Innovators, the podcast for leaders who are scaling companies built for the modern world. We sit down with founders and experts in distributed work to explore how they've broken down barriers and solved the real-world challenges of growing and running remote teams. Each episode dives into practical strategies for onboarding, IT, security, compliance, and everything it takes to build a thriving distributed business. No fluff, no theory, just what works when your team is everywhere and operations never stop. Here are your hosts, Robert Phelps and Jake Gump.
Welcome to another episode of Remote First Innovators. Today I've got a really special guest. He's the CEO of a company that is genuinely changing the way families access healthcare for kids. 24/7 from anywhere in the country without ever leaving the house. He's got a deep background in healthcare, technology, and operations, and he's building something that I think is going to be a category-defining platform. Eric Doherty, welcome to the show.
Jake, good afternoon. How are you? Thank you very much for allowing me to be on this. I'm really excited to get into this discussion and talk about not only what we're doing, but obviously some of the aspects of just health in general that's happening out there around the country and honestly around the world.
Thanks, Eric. Thanks for your time. And before we get into talking about you, I want to start with the problem, because I think everybody listening has a story about sitting in an urgent care or ER with a sick kid waiting forever, and just how broken is the pediatric care system in this country right now, really?
Yeah, well, it's not just with kids. It's obviously adults run into the same issue, right? It's an ongoing issue. It happens in the urban communities where, if you're in a big city, you've got long waits. And if you're in the rural settings, not only do you have to drive 2 hours or even, 2.5, 3 hours to get to a doctor's office, you still have to wait there as well. And, it's been an ongoing issue. A lot of it has to do with just the total infrastructure of healthcare, but it's really honestly the lack of providers, the lack of physicians out there as well. You see every day the issues where, in 5, 10, 15, 20 years, the number of physicians that are not only currently in the marketplace, but we're in the future are not going to be in the marketplace, really, unfortunately, does not help kind of that healthcare paradigm. And, the essence of trying to make access better for patients, making, time minimized for patients is a key element of really what we're trying to do on the pediatric front, just because of the issues that they run into trying to go see a doctor.
Now, when you looked at the problem, why telehealth? Why was that answer for you? Why was that the answer for you versus just building more brick and mortar clinics?
Well, again, a lot of it was just the access side of it. My whole kind of intention is, when we looked at building the company, is the access and the speed that you can get in front of a physician. Again, as we just talked, the access point right now currently, if you go to a brick and mortar setting, if it's just a pediatrician office or it's an urgent care pediatric or adult type of setup, you've got to wait. You've got to wait maybe 20, 30 minutes, maybe an hour, hour and a half, 2 hours, et cetera. And obviously that's not efficient. And you're not even taking into account the time it takes to get to the office to then wait. And so the aspect of telehealth, obviously everybody has a phone. Everybody has pretty much access to a phone and or iPad type of setup in the convenience of their own home. And so if you can take that side of it and then take the technology side and basically connect that patient, that person in with a provider in very real time, very quick time, the essence of speeding up that process of getting great care is obviously just a click away with a phone. And I think that's huge.
You've got a phrase I love. You call the parents the CEOs of the household. What do you mean by that? And how does that shape the way that you built this platform?
Yeah, it goes into the decision making. If you're a CEO of an organization, of a company, you make the decisions on what needs to be done for the company and for kind of the business in general. Same thing with a parent. If they've got kids, I have 5. And so, I've been in that world. I understand it fully on, kind of what is needed and how things within a household need to be run. And when you have a situation where a kid is sick at 2 a.m. in the morning or 3 o'clock in the afternoon after they get home from school, they're not feeling too well, what do? Do you pack up the kids, spend a half hour to get to an office and then sit there and wait? Or do you, again, pick up the phone, basically get into a telehealth service, see a physician very quickly, figure out what is needed, get a diagnosis quickly for that child. And then, if it's a prescription, great, get the prescription sent out, potentially even delivered, which is, again, pretty unique from our standpoint. Or if it's basically recommendations of what needs to be done next, that's done. And at least, within 15, 20 minutes, you figure out you've got your problem resolved, or at least going in the direction of getting it resolved. Hopefully your child getting better pretty quickly. And so the aspect of doing that in well under an hour, well under 2 hours, is a huge element that I think, again, speed within our system makes the difference.
Yeah. Let's just walk through like what that experience actually looks like for a parent. Let's say they're trying to get their kid in bed and the kid's not feeling well. They're looking for an app. They're trying to go from getting the app downloaded to diagnosis. I mean, what's that experience actually looks like?
Yeah, I mean, again, if they're looking for help, obviously if they Google My Pediatric Doctor, they'll find us right away. Obviously, if they pull in, pediatric urgent care or pediatric 24/7 care, they'll obviously we'll be showing up pretty quickly on the Google type of search. Once they do that, they come into our system. Basically, they go into starting a visit with the physician. They enter their information into the system. What's great is that we'll have the ability to actually do both fee for service and insurance for that patient. And so they have a choice based either on their copay or how they want to actually access our system. So if they want to just pay a fee for service and use their credit card, that's one way. If they do run it through their insurance, we verify the insurance and move them right into the platform. In essence, once they get into the platform, there's what are called intake forms. So basically a number of questions that are asked of the parent. What is going on with the child? What's the, obviously, age, the height, the weight of the child? Are they on any medications? More into, again, if it's a sore throat issue, is it a rash issue? Is it a stomach or tummy issue? Is it a maybe headache issue? All of that information is asked within our intake form settings. Once that's completed, they're put into the portal to see a physician. And basically within minutes, they have basically a conversation either via text if they want it, or video if they would like it, to basically get feedback and kind of the next steps on what's needed for that child. And again, based on that information, we take a AI complement of data and basically give recommendations that the physician should choose from. That physician chooses that recommendation, be it a prescription or not, and then moves that patient forward and gets the help that they need very quickly. Typically it's done under 15 minutes. Sometimes it's even done quicker, which is pretty awesome. There's obviously the verification of the ID. There's a verification on the insurance if they go that route that needs to be taken. So that sometimes does slow the process a little bit. But in general, it's a very quick, seamless process and very easy to do. And that's, again, I think the benefit of what we're trying to do on our end is that with telehealth, through COVID, a lot of folks saw the benefits of it, but I think they now are seeing the true, time benefit, the patient's benefit, meaning patients and time and not having to waste time and not having to sit into an office where you lose your patients basically. But also it's the efficiency where you can literally see a physician, get your help that you need, and obviously get your life back on track very quickly, as opposed to taking and throwing all the kids in the car and going to an office.
I can tell you, being a parent, that this sounds amazing that I can just do this from the comfort of my home.
Yep.
First of all, not having to worry about travel, get everything packed up. I've got a 4-year-old and a 6-year-old, and it is a struggle. It's a struggle to get there. And then, you could be sitting up to an hour to 2 hours waiting for, the doctor to finish the other appointments. And I tell you, I think, targeting under 15 minutes, to me, I mean, that's faster than most people can get their insurance card out of their
exactly, or pack up their kids in the car and take off to the office. That, again, is another 30 minutes away potentially. Yeah, I mean, that's the whole crux of it, where if you can speed the process, make things more efficient. Again, from a healthcare standpoint, that's really what we're trying to do. If you can make it more accommodating for a parent, be it at 2 a.m. in the morning or 2 p.m. in the afternoon, the ability to tap into a system like this because of the technology that is now there, I think is huge. The other side of it is, and a lot of the emphasis that we're putting on within the company and what I'm kind of driving towards on the lobbying side is the rural health side. I'm having conversations with HHS. And one of the things that we're really trying to key in on is the aspect of individuals who are in the middle of basically, nowhere, where they don't have direct access to not only a primary care physician, but pediatrics specifically, which is a huge downfall for a lot of folks in those rural settings. How do you get them the care that they need as fast as possible? And the only way to do that right now is telehealth. The only way that they can get that care directly is by using a telehealth service where they don't have a 3-hour drive from North Dakota into, some major city in the state to get care. They can literally as you mentioned, in the family room, in the kitchen, in their bedroom, literally get that care with their child. If there's obviously insinuating situations where they've got to go and get additional care, totally understand that. It's a different kind of patient profile where if there is an urgent need, emergency need for that child, yes, you've got to take them into a medical facility. But in many cases where it's, maybe strep throat, maybe it's a rash of some sort, or they've been bitten by a bug, or they've got a GI issue. If you can handle that quickly within a telehealth system like we've got at My Pediatric Doctor, it's a game changer. I think that's revolutionary from a technology standpoint, but also revolutionary from a healthcare standpoint.
With the addition of Starlink as well, being able to be out in remote places and have internet, it is making it more accessible there. And it's fast enough to have at least a conversation. May not be able to use video, but you can at least, have the speed and have that ability to have internet wherever you are, whether you're in a cabin. So I do think it's definitely attainable now more so than it was 25 years ago, right?
Yeah, there's a new rural health initiative that's going on within the government. They got approved, I believe either late last year or the early part of this year, where they're basically funneling about 50 billion with a B into states across the country. Each state has a different amount. A lot of it's, I'm sure, based on rurality, but also based on population. But that's starting to get rolled out now. And what they're looking at doing is, again, just like you mentioned, how do they get internet access? How do they get Wi-Fi and kind of systems in from an access standpoint into locales within those rural type of state settings? And a lot of it is driven around, again, everything from Xfinity to Starlink and trying to figure out, how can they get the proper infrastructure set up from a internet standpoint, but then also give the ability to have, basically medical call-out calls like what we can do at My Pediatric Doctor for patients to get them the quick and easy access to care.
Now, give me some just, common, maybe just what are the moms saying about the service that you've heard, that the people that are using the service already, like what's the most favorite thing that you think that they're coming out and telling you?
Yeah, it's the speed. It's basically they're able to access the care that they need for their child quickly and immediately, basically, I would say pseudo immediately, where they're able to, basically get kind of the needs taken care of, which is cool. They're finding that the system is very easy to use, easily accessible. And then obviously with the insurance side, that's a huge win-win as well, just because, again, I think that the beauty of what we're doing on our platform is we've got the, two choices, and you've got the ability to, basically use a fee-for-service paradigm and obviously use credit card or go the route of insurance. Some folks have a very high insurance, either copay, or they've got more of a larger deductible that's needed. And so it may be more beneficial for them to go the credit card route as opposed to the insurance route because of that. So having those two options is a key win-win for that parent. And then again, as they're going into the system, it's very, very easy to use. It's very simple. I would say from an intake form standpoint, answering some of those questions I mentioned earlier, where they've got to go through kind of the signs and symptoms of their child. Once that's in, it basically gets them into the system to see a physician. And that's, again, access to care leads to better health care.
How about from the doctor standpoint? You have, 250 doctors, probably more coming. What would be probably the comment you hear from them on this change of pace or difference of being able to care for their patients?
Yeah, I think on their end, it's twofold. It's kind of the AI complement that's in the note taking, so it allows them to get kind of a quick access detail on what's going on with that patient even before they see the parent. That's a huge win-win for them. They can have it basically allows us what's called ambient listening, ambient texting, where it literally is taking the information in and providing quick notes. And a lot of folks are getting used to that. I think within some of the Google settings and some of the other settings within our communication emails, where it kind of allows you more, I would say, disparate information to come in and be more succinct, which I think is a huge benefit. But I think the other thing is just it allows them to choose what they and how they want to work. Within a telehealth service, the great thing is that you can work with physicians that are multi-state licensed. So that allows them to kind of pick and choose when they can work and maybe when they cannot. If they've got some of their work, let's say they're working at a hospital, but then they want to have extra time to work on My Telehealth platform, they can basically go into our calendar system and figure out when they'd like to work. They choose those times, and it makes it very, very efficient for them on their end because it works around their schedule. Let's say they've got kids. Let's say they have other things that they have to do in the workplace, 24/7 during the day and evening. They can pick and choose how they want to work within my system, which I think is very, very beneficial and allows them for, I would say, more minimal burnout, I think, in the long run. And so I've got a lot of folks that, have kids do part-time work with us. They may work elsewhere, but I think it really allows them to be, I think, in a better place within their physician setting to not get burnt out.
Man, using AI as a force multiplier, being able to get them data and information quickly.
Yeah.
I think no one's going to be opposed to that.
No, and I think it's becoming more the norm. I think folks are getting used to, AI. Obviously our whole system is HIPAA compliant. Our system is very secure from a data side of things. And the way it's run within the AI setting, there's a number of, I would call, basically gateways that are set up to prevent data from being released, and used inappropriately. And so that's a huge win-win too. We're trying to really set up those guardrails within our system to ensure the safety and privacy of parents and obviously their kids. So there's a lot of things, as I mentioned, even like before, where the ID is verified, the insurance is verified. There's a lot of questions that we take in within the system to make sure that that patient is the right patient with the right parent. So that's a huge, I think, win-win from the security side of things. But the AI component just really helps drive, I think, again, that efficiency of providing the best care for the patient and obviously better care for the physician to make for that parent's child.
Now, I want to know just how somebody ends up here, because this isn't a small idea. I mean, this is, I think this is like a go change the entire industry kind of swing. I mean, so what's the story on this? You got a background that spans healthcare and operations and technology. I mean, where was the moment that, all three of those things clicked and you're just like, man, what am I supposed to be building? I just want to know if this came.
Yeah, telehealth is, I would say, pseudo new to me. As you mentioned, I've been in healthcare all of my working life. I was born and raised in healthcare. To be honest, my parents were in that side of the space where my dad was a pharmacist, my mom was a microbiologist, and so grew up with science and kind of the aspects of science and health. And I've had call centers, I've had a number of roles where I've basically run the operations within healthcare settings, and even on the digital and AI side. And this was just a complement of everything, if you really think about it, because you've got the access point of a parent or, basically a patient coming into a system. That's kind of the digital side of it, right? Then you have the parent and child, getting that information in from the intake side. So there's that science side, because you have to ask the right questions of the parent to say, okay, how are they feeling? What are they doing? What medications are they on? So there's that part. Then you have the other side, where it's the physician then having that conversation with that parent about their child. That's healthcare, right? And so, I've kind of lived that kind of, I would say, journey throughout. And so I understand what it takes through all those different steps. And then you throw in, because of my pharma background, and also kind of the background within the lab structure, we're able to prescribe medications for the kids. We're able to basically supply labs. So if for some reason, we do need more information, blood work, et cetera, that can be ordered. And again, yes, they'd have to go and drive to a lab, but again, if it's needed, you're going to have to do that either way at an urgent care setting or in our setting. But then if you do just get a prescription, that prescription can either be delivered via some of the delivery services that are out there, Amazon, et cetera, or they can go pick it up at a CVS, Walgreens, Kroger here in where I'm at in Atlanta, or Publix, et cetera, and then basically get the prescription very quickly. The other side of it then is the follow-up. Basically we have mechanisms within our system that provide the follow-up for the parents to say, okay, how's little Billy or how's little Jennifer doing within, the couple of days after we have seen that parent and that child, just to follow up to say, hey, do we need to do something else if that child's still not better, or make recommendations of what may be needed next for that child, what other care, or maybe potentially there might be more urgent need to do something and have them go into maybe a hospital ER. But at least there's that follow-up mechanism too. So kind of taking that whole, I would say, global type of viewpoint and look as to what we are and how we operate, that has been my world for 20 plus years. And so understanding that fully, I think, is a key add. And then, like we talked, the AI side, there's that part of it that is so cool. There's so many different things that I think from a technology standpoint that are happening, not only week to week, month to month, but literally daily to hourly, that are coming out that can really truly be a game changer in the marketplace on a number of different levels within the AI side. So we're looking at that specifically to really drive, kind of the efficiencies within the system, but also ultimately the better care for that child, which is, I think, the win-win for everybody.
Being in IT, I consistently hear people saying, they just want stuff all in one place, and they just want one click and it does everything. And just one click integration with just everything. Right. And so, I think, from that standpoint, how has it been working just with all of the different, insurance companies, all the different EHRs? I mean, there's just, the market's got all kinds of different products, right? So, how's it been just integrating and developing all that from your standpoint?
No, great question. I mean, the great thing, again, because of AI and really because of the technology side of it, things are easier. Back, I would say 10, 15 years ago, it was like pulling teeth to get data out of a system and moved over to a different system. So if you were, let's say, at a physician's office and they had a electronic health record system through Epic, and now you were in a different system with a different physician using maybe Cerner, which is now Oracle Cerner, or Oracle Health. The ability to move those basically physical records, the patient records, from one place to the other just wasn't happening seamlessly. Now it really is. There's basically ways to move that data very quickly. And so the ability to kind of, okay, if you're coming into our platform, we'll be able to actually pull up all of your information pretty much in real time, which is a huge win, and then provide that information back. It helps the physician, which is great, but we can also help and provide that to the parent as well. And basically they can keep their records with them, they keep the records handy, and it makes better care for them as they come back, maybe a second or third time or fourth time or more with that child if they have any other issues. That way you see a record of what's been done in the past, maybe what medications they've had in the past, have they had any issues in the past with those medications. All of that could be wrapped up into those medical records that then provides, again, a better picture for that physician when they're seeing the patient for the next time.
I think that we are kind of, speaking about we can kind of touch on AI here for just a minute. I feel like that there is such huge potential. Now, for most people that are used to the typical brick and mortar and then used to the same doctor, I think we're actually at a point where, the AI could almost do the diagnosis and then have a doctor sign off. The AI can speak in a persona of the culture and where the person's from and how they like to communicate, and having just a really catered experience. I mean, how far do you feel like we are from that?
Making a diagnosis, God, I hope a far way away, because we don't want AI, we don't want a computer or data making a decision, right? And that's, again, where those guardrails are really needed in a lot of systems. I think it's, I look at AI like we did 20 years ago with Google. I mean, it's kind of what I've used as an analogy before, where it's a tool. You know, if you use it as a tool, handle it as a tool, look at it as a tool, that's great. You know, that's the way it should be used. It's not going to be and should not be, especially in healthcare, should not be a determining factor in a decision-making situation in healthcare. It should be a way of providing information, providing, I would say, seamless and more integrated and more specific information on potentially providing information to make a diagnosis. I think that is kind of the pathway that I see AI as being hugely beneficial. Where I also see AI working is on the, I would say, the data side of anything that's coming in from a screening tool or some type of application where it's looking at something, seeing whether or not it's this, or that. If it can show through AI that it probably is that, and then provide that information over to the physician, that's huge. That allows that physician to make a better determination on what's going on with that patient. A good example, you know, if you've got a rash, there's AI applications out there now where it would take a picture of something on your skin, and through AI can kind of give availability on what that issue is basically to the physician. So they can say, okay, it's ringworm, or it's eczema, or it's a poison ivy type of rash. From that, at least the physician knows, okay, if it's ringworm, then it's some type of prescription that's different than poison ivy, that's different than eczema. And so having that information as kind of a go-to, it allows them to direct a better pathway for that patient, and obviously the prescriptions that would need it for that patient as well.
Man, that's exciting to think about. You know, I'll throw a question out there. I was wondering, you know, think 20 years from now, you know, do you see brick and mortar still being here? I mean, do you think it's basically going to be replaced with telehealth?
No, I think you'll still need cases where there's got to be still that touch, that human interaction with a physician and a pediatric patient or adult patient. There are still times where you still need to have that direct contact. And a lot of that could be, again, having labs being done. You know, I look at like an ortho type of physician, orthopedic physician, where they've got to do some bending and movement to make sure that that knee is working or that shoulder is working correctly. You know, on the pediatric side, it's just making sure and checking up with that patient just to make sure that they're doing well, that they are healthy, they're looking healthy, interacting healthy, can communicate, et cetera. So you're still going to have that side of it. I think where the telehealth side of the world really makes a difference is allowing, you know, parents not to have to take off for work to go into a doctor's office. You don't have to worry about going into a doctor's office and potentially getting more sick because there's other kids that are in an office that are sick. You don't have to worry about, you know, taking off on a Saturday night at 2 a.m. in the morning and trying to find an emergency room. You could do a telehealth service and say, hey, isn't an ER worth going to, or can I handle it at home? So those are the little things I think for telehealth is perfect for. And then as follow-up, there are those cases where, you know, we do work with physician groups and doctor groups around the country where we still have that access point. If they do need to go into an urgent care or pediatric urgent care setting, they can do that, and or obviously get their labs done either at the office or into a LabCorp request lab type of system.
Man, that's great. That's a great thought process on that. And I still think people will crave that human touch at some point, right?
Yeah.
Now, managing remote teams, I talk to business owners and entrepreneurs all the time. That's hard enough, you know, in different business environments. Now you have managing remote physicians who are making their real-time medical decisions about children. And that's on like a whole different level of accountability.
Right.
You know, how do you maintain the clinical quality across a distributed workforce like that?
Yeah, a lot of it's communication, just making sure that they're kept up to speed on what's going on within the system. If there's any changes that are being made, anything we've added to the system, et cetera, that they're communicated with in a very timely manner. Obviously, they've got to keep up with their side of things with regards to licensure and then credentialing on our end as well. So we make sure that that's all processed and up to date. We've got systems in place where, you know, they are basically given a heads up within their licensing side of things. So if there are 1, 2, 3, 4 multi-state license type of setups that they know what they need to do either on the CE side or recertification side to keep the licenses going, which I think is a key element. And then anything that we're doing on the AI side, if we are adding in anything from a technology side that benefits either the patient or the physician or both, but they're kept in the loop on what that does, how that operates, basically what it will do to the workflows. And workflows is basically the process of seeing that patient. And they're trained on anything that's done within the system as it's brought in new, which I think is a key benefit, and kept up to date from that standpoint.
Yeah, and speaking of that, how does a physician thrive in your network? And what does that model look like? How are you setting them up for success? Obviously, you're giving them the flexibility on schedule, and then they have some tools. Is there anything else that you would see a physician striving in your model?
Yeah, I think those two things make it thrivable. They're able to basically schedule on their time, which I think is huge from a physician standpoint. We're getting anywhere between, I would say, 2 to 4, maybe 5 physicians a day that are basically sending in their resumes and their information to want to join our platform, which is huge. We're not putting out a calling card for physicians. It's on our website, but we're not, promoting that. But yet I'm getting those physicians who are looking for something, looking for either added amount of work, or they're looking for more of I would say, a complement to a better way of life and not being burnt out, or maybe they got burnt out and they want something that they can basically work within and not get burnt out again. So I think that's the complement of what we're building, and the ability to basically tie into a calendar system where they can pick and choose the times that they want to basically pick, allows them that freedom and flexibility. And what's also great is because we are the first and only urgent care pediatric telehealth service in the country. We cover all 50 states, we cover Guam, we cover Puerto Rico. The ability of tapping in across the country is huge. So I can have, physicians that are out on the East Coast and physicians that are all the way out to Hawaii, and I've got Guam as well, where they literally can pick and choose times from 12 o'clock a.m. to 12 o'clock p.m. And that's a huge win-win.
Wow. I mean, the thought of 24/7 childcare is actually pretty crazy when you think about it. Having, in the middle of the night, you got something going on and you need some feedback, and you really think that your child needs a physician. That's amazing to think about.
Well, and again, I look at us as being, kind of that pseudo ER where, at 2 a.m. in the morning, if you come into our platform, you're going to be seen. You come into our platform, you're going to get the help you need or the direction on what's needed. We've got cases, sure, where the parent comes in, it's an issue that we can't deal with it on telehealth, where it is a more severe concern for that child. They're recommended. Take them into an acute setting, take them into an ER. They've got to do that, and that's also kind of a huge, I think, win-win for our services at My Pediatric Doctor, where you've got the ability to basically have that patient come in and care for that patient, care for the needs of what's going on with that patient, and figure out, is it something we can deal with easily through telehealth, or do we need to really truly get them into a ER type of setting?
How does that exchange happen? Let's say that there's a situation where, they do need to go to an acute setting, and how's that transformation of information happen between you guys and maybe the place where they're going or they have to travel to?
Yeah, we make those recommendations on where they need to go, and basically, if needed, we'll send over the data for that physician. Typically, what will happen is we'll get a call out later to be able to do that, but generally, they go and take them into the ER setting, and then have that patient seen by either that ER, the hospital, or an urgent care setting.
And that triage is already done, and it's anything they have something to go off of, which is cool.
Yep.
Now, let's talk about where this possibly could go. When we're talking about expansion, it's a growing success here in the U.S. Could you see this going international?
I do. Yeah, I do. And really the aspect of, again, the ability to tap into the technology side because of now internet being more and more accessible, either via, groups like, Xfinity, Comcast, et cetera, but also the Starlinks of the world, and the ability to tap in to real-time data using phones. I mean, most people around the world have a phone or an iPad, a type of setup, either Google or iPhone or whatever. And so the ability to really have I call it a physician in your pocket, and being able to talk to a physician, get your care taken care of with your patient is huge. With technology, again, because of the way it's set up, there's a lot of ability within platforms now to go multilingual. So we're looking at that aspect of it as well. How do we basically add in features within the system to allow multi languages? So you'll see that very soon. And again, that just lends itself to the international side, where you can go into a country and basically set up a system in country to basically see patients, be it pediatrics or whatever, in a very, very short order. So in basically 27, that's our go-to.
I think I did see something about adult care launching this summer. Is that true?
That is true. That is true.
Okay. And then, I was just kind of curious, what changes, when you go from pediatric to adult patients, and do you think it's going to be harder or easier?
I don't think it'll be harder, because the systems in general are fairly the same. Obviously, you've got different nuances on the intake forms and things like that, but in general, it's another I would say another business vertical that lends itself to, again, quick access, efficiency, et cetera. It's different physician groups, because you obviously have more of an adult need, obviously, not just pediatric needs, so a different complement of physicians. But yes, I mean, just from the pure setup in the platform itself, it's very similar, but it allows, I think, better care for families. I mean, now you can have the mom and dad at the adult side, you can have the kids at the, obviously, My Pediatric Doctor side, and allow the two groups to basically work under one umbrella, which is huge. And again, as you mentioned before, that one login service, that one complement type of access point, that's what it also provides. It literally provides one access point to be able to go either way. Either you see a physician for a pediatric type of visit, or see a physician for an adult visit, and still the same nuances. You have a choice of either a fee for service, credit card payment, or using insurance to basically see that physician.
Now, we care about our children, but we also care about our pets. And I could see this, going into, veterinary telehealth as well.
Exactly.
And so, I mean, tell me about that market. Is that you guys are going there too, possibly?
That's a right market. And again, the complement of that is that you have the entire family, right? You have your kids, you have your adults, and you have the other kids, right? The dogs, cats, et cetera. And so the ability to kind of tie in the full ecosystem of a family is of huge value, where again, one login, one place to go to have all of your health needs taken care of. I think that's a huge win-win from, again, an accessibility standpoint, an efficiency standpoint, but also just darn good medical care standpoint, and the ability to really provide, the care that's needed for the entire ecosystem of a family at one's place. I mean, that's huge.
Thinking about this, the VA telehealth it would be very close to my heart. And, veterans in rural areas, I'm from West Virginia, especially, they get stuck on some people feel like they get a raw deal on the healthcare access, right? How does serving that population look like for you?
Yeah, that is an area we're looking at. Again, I've got a lot of veterans in my family, both immediate as well as I would say immediate / they've passed away, but definitely in my family, from Army, Navy, Air Force, no Coast Guard that I know of. So unfortunately I don't have that side of it, but yeah, it's been a pretty cool complement of folks that are in my family. And, do they have the VA to go to? Yes. Are there other needs outside of the VA that we could potentially handle and help with? Yes. And I think that's a really good go-to for us from a group standpoint and an organization standpoint, where again, you could provide easy access, quick access, and quick determination of what's going on with that veteran, but also their kids and their families. I mean, that's, I think, another side of it. And then there's also the international side. A lot of veterans, they've served our country, and again, salute to all of them that, thank you for your service. But there's a lot of them that are not here in the United States. They've stayed elsewhere. They've either, set up and camp near where they potentially worked in a camp, or set up within the military, or they just are elsewhere now. And so outside of the United States. And so the ability to potentially give them, needed care internationally is something that is something we're looking at discussing, that there could be a very, very good complement to what's currently happening here in the United States internationally for those veterans and their families. And maybe their pets too, never know.
Yeah, right. I love that. Another one that I was thinking about was the oncology vertical, right? It's a very emotional place to be, given as someone who, just got a cancer diagnosis, and they have the ability to go get a second opinion from one of the best cancer centers in the country, from their couch, and I think that would be a huge opportunity as well.
Yeah, it is. It is. And we're looking at that too. I think, again, everybody that's listening to this and viewing this, I will guarantee you've been touched somehow, some way by somebody that has had or diagnosed with cancer. Everybody, is connected somehow, some way, a friend, family member, et cetera. And, where I think it'd be a huge win-win is if you've got the ability to stand up a service across the country. And, it works kind of two ways. And number one, it'd be for those patients, those individuals who are concerned that they might have cancer. So let's say they've found a lump or they're not feeling too well all the time and they really want to get an answer. Again, that could be just a primary care visit, yes, but I think on the oncology side, it's pretty specific. If you don't feel well and you think something's going on, it could be a good access point for you on that end. The other part is really those, as you mentioned, those individuals who are maybe newly diagnosed. They got diagnosed at a group wherever, and they want that second, maybe even their third opinion, just to say, okay, what happens next? What do I do next? What kind of treatment do I do next? Where do I go? And I think that's the other kind of the beauty of what I'm thinking through is the ability to kind of give them a feedback loop on that second or third opinion, and then provide it as a feeder source and a referral source into cancer centers and cancer locations, depending upon either their geography as to where they're living or what's convenient for them, or what care is best for them. So if there is a specific cancer that is to them needed to be taken care of, maybe there are certain groups around the country that really specialize in on that type of care. And so having that ability to stand that up and have that patient referred out to City of Hope here in Atlanta, or Moffitt Cancer Center down in Tampa, or Johns Hopkins up in Maryland, or Mayo, either at one of the three locations, Jacksonville, Minneapolis, or out in Phoenix, outside of Phoenix, Arizona, where do they go? And so I think that's a huge win-win as well, where you've got, again, you're trying to do the best thing for patients and the best care for patients. How do we set that up, and how do we provide that for patients? The other thing too, and I'll do a shout out here to Shane. Shane, you're the CEO of American Cancer Society. Ping me. But I'm even, thinking for the American Cancer Society, connecting with them and having them be part of this kind of ecosystem to drive, kind of not only the patients into the system, but also make the awareness happen across the country for patients, that they are given the ability to say, hey, here's where I want to go to get more information, more kind of direction on what needs to be done next. That's what I want to try to do.
Last time we talked, you mentioned building a data ocean, right? And as you collect more patient data, it becomes enormously valuable for the population, for health research, for pharma partnerships, clinical trials. Just paint that picture for me and for us. Where does that go?
Yeah, that's, I think, from how I'm structuring kind of the outlook of the organization, there's a lot of data, a lot of information that is going to be accessible, and providing better use cases, better data to make better decisions, I think is kind of ultimately what I want to try and drive towards. On the clinical trial side, one of the things I'm looking at doing is, on the pediatric front, right now, there aren't that many drugs that are, I would say, in clinical trial use in the pediatric marketplace. So how can I expand that? How can I get better pediatric patients in clinical trials to benefit future pediatric patients? And how do I do that within the pharma side or even medical device side? The other part of it is the population health side. So working with government, be it HHS, CDC, NIH, et cetera, to where as I'm getting more and more data on patients, that information can be very, very relevant for those government institutions when it comes to, again, seeing what's happening across the country, because I can get obviously down to not only a city level, state level, country level. So that's going to be, I think, very, very beneficial. And then there's the other side of just in general outcomes and figuring out, okay, if you've got patients that are put on this drug or that other drug, which one of them is working potentially best. And through data, you'll be able to find that out over a period of time. So that is kind of cool, both from a pharmaceutical standpoint, where you can actually see which drugs work the best. But again, it goes back to that loop of the government/insurance payer side. They can then look at which drugs for them are the better drugs to then kind of push their services towards, because it works better than the other two.
Would you happen to have any major success stories that come to mind when you think about, your platform and how it really helped somebody maybe uncover something quickly? Maybe it was just, hey, you helped, get, quick, help really quick. And then we got to acute center. Is there anything that you have that, that's, come up right now that you can share with everybody?
Oh yeah. Pretty much on a daily basis, it comes up. We've got parents that come in and they don't know what to do with their child. They've got a rash, as an example. They don't know what the rash is, where it came from, what to do with it. And again, right there, it's a pretty quick, easy, and I would say seamless type of situation where the doctor can handle those very quickly and obviously get either the provided recommendation on what's needed and or prescription if needed for that pediatric patient. So that's a win-win there that happens, I would say, like similarly on a pretty much daily, if not weekly standpoint. The other side, it's the I would say the respiratory and kind of throat issues that come up. We're coming into summertime, so it's not going to happen as much. But allergies, the last couple of months, the allergies were coming in fast and furious. So there were issues with kids, runny noses, et cetera. Yeah. And, how do you get treatment for them quickly? So that's that side of it. And that was handled very, very nicely. I've got kids coming in with concussions. What do you do with a concussion patient? The recommendations are made by the physician. If they're still not feeling well or they start having vomiting issues, that's a time where, because of the recommendations, you take them into emergency room because there's something else going on and underlying within that concussion patient. The other side is we're looking at everything from asthma to diabetes. So there are cases where if a child's having some type of sugar issue with their diabetes, we'll look at that. If there's issues with asthmatic patients, we'll look at that. The whole kind of system itself is set up to be, again, a care system for the parents and for the child. So we look at all of that. I think one other thing is the kid at 2 a.m. in the morning where they've got a GI, situation where it's basically a vomiting situation. What do you do with that? They make direct recommendations on that very quickly. And basically in most cases, I would say, if not all, there's been a great, recovery of that child, which is awesome. Knock on wood, if there is something that's worse, they'll recommend, again, going to an ER if need be, just because that patient does need to get seen directly by a physician hand to hand.
I can tell you, as being a parent, I'm definitely excited about this because there's times where you just, stopping and looking up something on Google just ain't, it's not you just don't have the time or patience for that. And it'd be so nice just to be able to get in and get your child seen really quick.
Yeah, and again, I think what we want to do, and that's why we named it as easy, I think, as we could. My Pediatric Doctor, right? MyPediatricDoctor.com. You put that, on your phone. You put that on your computer as a tab. If you need it, you go to us and obviously have a great experience. If you're already part of the group, that's even better because once you get in, you can get access at any time once you get in, and so that's a huge win-win as well. It's again .com. It's pretty simplistic and easy to access, but I think it's also top of mind as to what we do. I mean, we do pediatric care. We work in pediatrics. We treat pediatric children. We treat kids, and that's a huge benefit to any parent out there. And again, if you're a parent, that means you have a kid. Grandparents, you have grandkids. So, there's definitely a win-win to anybody who needs medical help to come to our website, see our physicians, get your care that you need, and again, insurance or fee for service. We take both, and I think that's a huge huge win for anybody in the healthcare system and that ecosystem that we talked about at the beginning.
Love it. Shifting gears a little bit, I wanted to talk just a little bit about leadership for anybody. I mean, obviously, this telehealth idea and from a business standpoint has been, quite a undertaking. And I just like to give some people, some insight into what running a company like this actually looks like, right? You're managing a medical live platform, you're building new verticals, you're raising money, managing a remote physician workforce, and you're preparing to go international. I mean, what does your day actually look like?
24/7, just like the platform. It's communication. It's making sure that I'm kept up to speed with what's going on within the business and vice versa, what I'm doing with the business. So communicating pathways to my team. I'm really big on strategic partnerships. So if I can develop those more and more with groups, with physician offices, with payers, with hospital systems, et cetera, to be their go-to, that's again kind of where my push is. Obviously, looking at even the aspects kind of underlying to that now on the international side and doing things that way. Working with government, both at the local level, state level, but also federal level, I think is huge. So a lot of those little touch points I'm deeply embedded in and working on both directly and indirectly. And really, I think just from a leadership standpoint, I've always run my business on 3 pillars. I mean, it's very simple. It's communication, it's transparency, it's teamwork. And if you have those 3 elements within a business, you've got a very, very well running business. And so, if you have those at the top of your mind as you're, making communication emails or having meetings, let's say like a podcast, but meetings that you're having with your team or with outside teams, just always having that at the forefront just lends itself to better business and lends itself to running a company efficiently.
What do you look for in the people that you bring around you? Because, you can't do all this alone.
Yep. Yeah, it's finding people who have a drive and passion. I think that's probably the 2 elements that I look for. You can always train folks to work systems. You can always train folks to understand how things need to work and how different kind of applications work within an organization. But to really have that passion and drive, I think an initiative, that's a huge win-win for anybody coming into healthcare in general, but I think into my group as well, where they've got kind of the mindset of, helping others. That's the passion side. The initiative of, if it's something that works best for the business, let's implement it. And let's see it work. That's the initiative part. And then I think that drive is just, I love to work. I don't call myself a workaholic. I love what I do. I love it because of the outcomes it provides for parents and for kids. And future stuff as well. And so having that drive part of it keeps me going, in the middle of the night if I wake up and think of something that should be cool to do. But it also drives me at, 5:30, 6 a.m. in the morning when I'm ready to go to work and get things done. It's that drive to help others and that drive to make sure that I'm doing and the company's doing the best it can to make those parents and kids happy.
Love that. I've been a part of, 2 or 3 startups myself. And, I always like to ask other leaders, there's usually scary moments and there's usually humbling moments. Do you have any, what was really scary for you at certain points building this business? And then, did you have anything that was like, completely humbled you and kind of woke you up a little bit?
I'm humbled every day. So I'll keep that at that. Yeah, I mean, I love my work and do my work, but I'm humbled in the role that I have. So I think that's number one, first and foremost. I think, just coming in because, as I mentioned, I didn't truly have, I understood telehealth. I understood what it was. I understood the kind of nuances of it, but didn't truly understand telehealth. And, having contact, call center teams and that type of thing was part of it. I got that part of it, but really, truly trying to figure out what was needed, how things needed to operate, how you needed to set up the business just in that telehealth environment was new to me. So I would say that was kind of heavy lift that had to be done right at the beginning. But, again, what's cool is you can jump into it. You can find others. We're part of ATA, which is the American Telemedicine Association, as one example. So finding out from that, how things are set up, how things are run, what happens within not only a state government environment, but also a federal environment. So really trying to get a good grasp on that. And then just really what is needed within the environment, again, the physicians, the EHR system, the front end as to how can we get access to patients? How do we get, those strategic partnerships set up with hospitals, with physician groups, with businesses that are self-insured? How do we wrap that into our system and get our name out there and our system out there? And so that all of, at the beginning and throughout has been kind of the drive part and was kind of the big heavy lift. But now that we're into it, we launched the company a month and a half ago on March 30th. Now that we're into it, roughly going on 2 months, I'm getting pretty acclimated with what's needed, how it needs to be done, what needs to be done, and how it needs to be run. And I think I'm feeling pretty comfortable with it and confident.
Well, what do you think was the over the course of your career, what's the best piece of advice that you've gotten from an entrepreneurial aspect?
Never give up. That's my motto. Always has been. So it goes back to pseudo dating myself, but I was a young kid when he did it. But they've said Jim Valvano statement. Never give up.
Yes.
And obviously he was dealing with cancer, and unfortunately didn't work to his advantage. But I think it still resonates what he did and what he said. And I think having that kind of, again, goes back to the drive part and helping others and never giving up in that aspect, never giving up helping others is part of what I've always kind of grabbed onto and felt that was a big push for me. Hopefully, folks have seen that over the number of years I've worked in different roles. And, within this role now as the CEO of My Pediatric Doctor, we're driving towards, making better care today, making better care in a minute, making better care, hopefully, every second of the day for kids and for parents. And that's my drive.
Love it. Now, you've had some pretty good role models in your parents with their careers. Has there been anybody else that's been an inspiration to you that's, maybe a mentor, somebody that's on your side that's kind of helped get you where you are, or that's just, had the right advice at the right time for you?
No, I appreciate that question. That one's awesome. It always gets me. So, it was really cool. So I got to know Bob Ingram quite well. Bob Ingram used to be the CEO of Glaxo Inc., Glaxo Wellcome, GlaxoSmithKline pharmaceutical company, and helped the transition when SmithKline Beecham and Glaxo Wellcome merged. And both of us, and again, he was older than I was, but both of us were Central Illinois kids. We grew up in Central Illinois. He went to Eastern Illinois. I went to Illinois State, but we obviously had that kind of rural, again, kind of interesting rural background and rural settings as to where we grew up. So we had those Midwest values, I think, from a business standpoint and from a life standpoint. And really from him, those were kind of where those three pillars came into play earlier, that teamwork, communication, and transparency. And, he just really, again, very humble gentleman. And again, hopefully I exude that as well. But he, that was what was really cool about him. Yes, he was the CEO of a multi-billion-dollar organization, but he was a really cool, humble gentleman and a true gentleman. And he liked fast cars, loved Porsches. I'm a Mercedes guy, so we differ there. But definitely it was just a cool thing to know him and to appreciate kind of his leadership style. And I've tried to emulate that. Another one I'll add, and he was also with GlaxoSmithKline, was Bill Pasek. Had him as one of my direct mentors within management, and so grew up with him and just kind of his again humbleness as well, which I thought really lent itself to what I've been able to do from a leadership standpoint. And you mentioned my parents. Yeah, my dad and my mom. I would say directly they were really cool in helping me perfect that drive right at an early stage, because I was an Eagle Scout at age 16. A lot of that was because they pushed me to get my little badges that I had to do for getting Eagle Scout and just things like that. I learned early on to do that, and I've always have worked as a kid, I started working, at age 12. I was caddying, at a very early age at golf courses. So I got that work environment set aside within how I operate. And I've been blessed to have some really cool touch points as far as people goes in my life. And I've got, obviously I'm married, have kids, got 5 kids, and it's just an awesome situation.
Love that. You got to see how business was done on the golf course, being a caddy.
I did. And see a lot of bad golf too. So that was all fun.
Oh my. That's great. Eric, before I let you go, tell the people, where can they find My Pediatric Doctor? What's coming? Where can they connect with you personally?
Yeah, no, appreciate that. So again, if you have a phone, if you have an iPad, you have a computer, it's mypediatricdoctor.com. You can do www, but you also just can do mypediatricdoctor.com. You'll find us anywhere 24/7. But we are the first and only pediatric urgent care setting in the country. Again, we'll be moving into primary care pediatrics. So again, keep wary of that. That'll be pretty cool. That'll be coming out. I'm on LinkedIn. So anybody who is on here on LinkedIn, you can find me very easily. Go to LinkedIn, Eric Doherty. My name is here on the bottom. You'll be able to find me, but would love to connect if you need to. Would love to, if there's any folks that need any type of mentoring, that'd be great. I'd love to offer that. And just again, I'm here and I really appreciate, Jake, the conversation, the questions. But I think for anybody that's here that has a kid, we're here to help. And if there's a way that we can help, connect with us and let us help. So that's what we're here for.
Well, stay tuned. I'm probably going to end up trying this out myself because I'm, being an IT guy, I think this is awesome. I came into this conversation knowing, you're doing something cool, and I'm leaving thinking you're probably building one of the most important remote first companies in the country right now. So, so folks, if you got kids, go to mypediatricdoctor.com right now, bookmark it, download the app, whatever you got to do. Because 2 a.m. is not the time to be figuring it out,
Right. Totally agree.
All the links will be in the show notes as well. And hey, if you're a remote or hybrid teams, IT situation is keeping you up at night almost as much as a sick kid, come find us at Creative IT. We built Remote OS, which is, onboarding, offboarding, device management, compliance, employee training, all of it in one place. Built by remote team for remote teams. So go check that one out. And until next time, we will see you in the next one.
Remote First Innovators Podcast requires more than a conversation. It takes action, research, and collective wisdom. If today's episode resonated with you, we'd love to hear your insights. Join the conversation and help us shape the future together. We'll be back with more stories, strategies, and real-world solutions that are making a difference for everyone. In the meantime, be sure to subscribe, rate, write a review, and share it with someone you think would benefit from it too. Thanks for listening, and we'll see you on the next episode.